Virtual press conference on the COVID-19 third wave and measures being put in place for the impending COVID-19 vaccine rollout in Africa. Let's take you there live now.
Got both doses. So what is the plan for the remaining 1.1 million people that are yet to get the second dose? And what and when is the next vaccine shipment coming in? And what is Nigeria doing to join South Africa and others that are involved in the discussions around local vaccine production in Africa, considering Nigeria is the continent's biggest vaccine market and could still be vulnerable to other countries' decision to restrict exportation of vaccines in their own national health interest right now and in the future? Thank you very much.
Thank you, Paul. So I hand over to the Honorable Minister from Nigeria.
Thank you very much, Mr. Adepoju. When we got just over 4 billion doses of vaccines, we began immunizing all citizens with the doses, hoping that by the time we exhaust the dose, we shall get more doses coming in from their supplies, from COVAX or AVAT. But with the outbreak in India, it became clear that we are not going to get enough vaccines and that the 12-week interval we gave might expire before we got new vaccines. So we changed our tactic to immunizing, instead of about 4 million, giving just over 2 million, 2 doses each, so that you have 2 million who are fully vaccinated rather than 4 million who are half vaccinated. But with time, we got assurances of second doses, more shipment coming in, and which includes AstraZeneca. In fact, we are going to get about 500,000 or 600,000 in addition to 3 million that's already promised by August, but about 600,000 before the end of this month. So we changed again to immunize, give more first doses. We do hope that by the time the 12 weeks elapse, we will have received enough doses of the AstraZeneca vaccine, which is the only vaccine we are using so far, to give second doses to all the others who have had only one dose so far. So the strategy for more vaccination, for more vaccines, is beginning to pay off. And we're expecting other types of vaccines. Now we're expecting more of Moderna and Pfizer, and in fact, Johnson & Johnson, 29 million doses. As for local production, Nigeria is keenly interested in being a hub for local production in Africa. We have worked out a business plan. There is a company in Nigeria, private partnership with government, that is to lead the vaccine production. We are going to bid for technical support and be one of those considered for production of vaccines in Africa. Over.
Thank you very much, Honorable Hanire. And members, distinguished members of the press, we do have a huge number of questions, and we request you to limit your question to at least one priority question for our panelists to answer. So next we go to Gabriel from Gabriel. Please come on with your question. Gabriel from Wall Street Journal, go live with your question.
Hi, thank you so much. This is a question for the Honorable Minister from Nigeria. You spoke a little bit about the shortages you've experienced in terms of supply. Are you expecting any doses as part of the US donation? And if so, how many and when do you expect to see them, and what vaccines? And given how constrained the supply is in Nigeria, were you surprised that you weren't among the first countries to receive some of the US vaccines? Thank you.
Thank you. We are expecting many vaccines from many sources. So things have changed from a time when we had a lot of anxiety about when we are going to get the new supply of vaccines. Right now, Nigeria is in the process of paying for 29 million doses, just over 29 million doses of vaccines from the African Vaccine Acquisition Task Team, Johnson & Johnson. And so that process is ongoing. We shall not receive the vaccines before, I think, August. But we have a bilateral arrangement for Moderna vaccines, which we have just received through the COVAX facility from the United States, 4,080,000 doses, which are expected in time. We already prepared the cold chain equipment for that. We're expecting 3,900,000 of AstraZeneca and another 3.5 million of the Pfizer. So if all goes well, as from the end of this month, July, through August and beyond, we are going to have more doses and more varieties. All these vaccines have already been given emergency use authorization by the Nigeria Agency for Food and Drug Administration and Control, NAFDAC. And we are prepared for all the diversities, various types that are coming in, both those that require ultra cold chain and those that require ordinary refrigeration. The teams are all prepared. The collaboration between the state, the federal government and the state, and distribution to last mile has all been set up, and all the monitoring mechanisms are in place to begin immediately, not only distribution, but the administration of vaccines, and also taking record, collecting data of adverse effects following immunization. So we are looking to scale up the vaccination capacity, the rate at which it is being administered right across the whole country, with a little bit of emphasis on those areas that are already the hotspot now, mainly Lagos and 5 other states of our country which are not so heavily impacted as Lagos, so that we have a bit of emphasis given to those areas. Over.
Excellent news right there, Honorable Hanire. So now we go to a question from Reuters to you, Dr. Moeti. And it says, how satisfied are you with the announcement that the Pfizer and BioNTech SE have made, and the fact that they've struck a deal with for South Africa's Biovac Institute to process and distribute over 100 million doses of their COVID-19 vaccines for the African Union beginning in 2022? And how satisfied are you that the fill and finish is enough technology transfer to reduce Africa's dependence on Europe and the US to make vaccines?
Okay, thank you for that important question. I think it's a very important start, and it is an urgently needed partnership to change the situation that I described and the two ministers very eloquently described as well. It is very important that African countries start to acquire vaccines from whatever source, and if it is through beginning with a fill and finish, and that can rapidly be scaled up and make the vaccines available, that is a very good start. As WHO, we are recommending and advocating very strongly, though, for technology transfer, because we are looking beyond this crisis, beyond the immediate future, to Africa acquiring the kind of capacities that's needed, including the expertise to produce the vaccines that are going to be needed in the future. And that will need agreements with pharmaceutical companies who own the IP, technology transfer, even agreements around the intellectual property, so that we really get into the kind of partnerships that can be sustained into the future, that can build the capacity, indigenous capacity in Africa, indigenous knowledge, ability to use and shared technologies, of course, taking all the precautions necessary in relation to the interests of the IP owners. But it is a very good and important start.
All right, so we have a question now for you, Honorable Zahaf, from Mauritania. It comes from Halilou Dagana from the national newspaper Horizons in Mauritania, and it says, how many Mauritanians are expecting a second dose, and are these doses available? Over to you, Honorable Zaha.
Merci beaucoup. Merci beaucoup. Merci beaucoup.
Thank you very much. Thank you to the newspaper L'Horizon for this question. So for the second dose of AstraZeneca, 125,000 people are expecting their second dose. Recently, we have received 175,000 doses. We started to vaccinate people. We received it in April, and we had started to vaccinate, but in June we realized that we would not be able to use up these doses before they expire at the end of August. This is why we sped up our rollout, and we were able to vaccinate 125,000 people, and that was in June. And the second dose should be administered, it should have been administered 2 weeks ago, but we still have up until the middle of October to do so. So we have 125,000 people waiting for their second dose. We were promised 150,000 doses of AstraZeneca, 165,000. That was promised for the end of July. So this will be a great relief for us because, of course, we are under pressure to administer those second doses because we are faced with the third wave of the pandemic. So we are under tremendous pressure. Thank you very much for this question.
Indeed, we do hope that you do get those doses, just like we're hoping for the other countries too. So now our next question is from Ruth McLean from the New York Times, and the questions come to you, Honorable Hanire, and to you, Dr. Moeti. And it's more or less the same question. So for Honorable Hanire, what proportion of the COVID-19 tests reported in Nigeria's official figures are done on travelers, and what proportion are on non-travelers? And for the same, after the Honorable Ministers answered this, Dr. Moeti, what proportion of tests on the continent as a whole are on travelers, and what proportion are on non-travelers? Over to you, Honorable Minister.
Exact figures for the proportion is not in this disaggregation. I can't give you off the cuff, but we have about 170,000, about 2.5 million tests done, and 170,000 positive cases so far. About 2,160 fatalities. And the tests are being ramped up. We have developed a new strategy to do tests randomly working with NGOs at hospitals, airports, and also at motor parks, particularly on travelers internally, despite the advisory to reduce travel internally. It still goes on, and congregations still go on. So we want to do ramp-up testing in order to increase the volume and be able to see exactly how the trend runs with this third wave of COVID-19 that is already threatening our continent.
Thank you. To you now, Dr. Moeti.
Okay, thank you. That's a very good and important question. We don't have the exact figures in WHO either, but we estimate that between 25 to 35% of the tests that are done and reported are on people that are traveling internationally. And I'd also like to say that these are mainly PCR tests. We are encouraging and would like to see countries use even more the antigen rapid tests, because that will enable then some of the testing that needs to be done to follow up on possible cases, to test for clusters of transmission to be carried out to supplement the tests that have been done on travelers. We need to keep a balance between, of course, testing people for the purpose of their being able to travel, and also to keep a focus on the public health interventions, identifying contacts, and making sure that the public health actions of isolating, preventing further transmission are carried out, and to see also when we have intense transmission happening in countries. So we're updating, in fact, our guidance and our advocacy for the use of rapid antigen tests combined with the PCR, and are also urging countries, encouraging, and will be supporting countries to find ways with their partners to report on the testing that is done with using the rapid test. We believe that this is underreported. So there's more testing being done for these public health interventions possibly than we are getting because it sometimes is using rapid tests. That's something that we're working on right now at the moment, and we think it's very important to keep that balance.
Thank you, Dr. Moeti. And the next question comes from Danielle Paquette of the Washington Post, and I'll give this to you, Dr. Mihigo. And she says, some countries are receiving doses that expire in a short period later. Are shipping delays widely putting vaccine supplies at risk of expiring before they are used?
Yeah, thank you very much, Fiona, and thanks for the question. Yeah, it's true that the short expiry dates of the supplies that are coming to the continent are indeed increasing the pressure on the rollout of the vaccine at country level. But we have seen that since the beginning of this pandemic, the most of the vaccine arrive with really a very short expiry dates. Most of the time, 3 to maximum 4 to 4.5 months, which really create an additional bottleneck in terms of rollout of the vaccine. When definitely you add on the internal hurdles at country level for the deploying of these vaccines, definitely we see that it creates additional burden. So we are really working with countries. We are really working to anticipate some of these issues, because here probably the key word is anticipation, because we know since the beginning of the response that most of the vaccine are coming with that short expiry dates. So countries are now kind of used to and very well prepared to make sure that these anticipated needs are really addressed at the beginning, so that we maximize the use of the supply when they arrive in the country.
Thank you, Dr. Mihigo. Our next question comes from Camilla Malplat from AFP, and it goes to you, Honorable Hanire of Nigeria, and says, what is the current oxygen production in Nigeria, and is it enough for the whole country? She also has a follow-on question. How do you explain that there are few cases in Nigeria? Is it because people don't get tested?
Thank you. First of all, the question of oxygen. Every state of Nigeria has an oxygen production plant, and they're all being repaired at the moment, 30 of them. And the government has sanctioned the building of additional 38 oxygen production plants, which is starting now. We do not think they'll be ready in the next couple of months. There are 38 additional. We're also getting 12 liquid oxygen tanks. We already have 2 on ground, and we're getting additional 12 liquid oxygen tanks, which are produced in 2 sites, 2 cities in Nigeria, to be able to supply oxygen, liquid oxygen, along with vaporizers. We are receiving about over 1,000 oxygen cylinders, and we have been working with industrial oxygen producers to repurpose industrial oxygen into medical grade oxygen. We have also been working with Nigeria Air Force, which has a large oxygen production plant, to supply oxygen at all points of need in the country. We do believe that by the time we are through with this, we have a very sound oxygen availability, sufficiency all over the country we should have over 70 oxygen production plants functioning. But as for now, we do not have any distress in oxygen. We are okay. So as for the number of cases, well, I do not know if you think that there are too few, but we have been doing a diligent testing, mostly driven by the states in the country. They are not the volume that we would like, but we are working on being able to step up the testing rate when we are faced with this threat of the third wave of COVID-19 by bringing in NGOs, and not only with working with state governments and local governments, but bringing NGOs who work on a strategy to collect samples and bring them to mass testing sites. So we have a larger sample. Of the samples we have so far, we are confident that they are not far from what the general picture is. We have not seen any large cases of unexplained deaths, as we call them here, because if COVID were playing a terrible role, which we are not seeing, we will see that the records in unexplained deaths or excess deaths, as it's said by epidemiologists. So we are going to improve on the testing, but so far we have no indication that...
All right, and so we come out of that World Health Organization virtual briefing on the third wave on the continent. It's time for a short break. My colleague Nompumelelo Siziba is standing by at the top of the hour alongside Nastasio Arendse to bring you all your business and market news as well as word news. It's good afternoon from me.